everybody. I would like to mention that because Dr. Win is now in the midnight of, uh, maybe he's not asleep, but I would like to spend some minutes to invite him to deliver some summary or impression about this conference before leaving.
Thank you, Dr. Wee, for inviting me. I learned so much from you guys. I think if one thing I want to tell you, I learned a lot from you. That's why it's midnight here, but I still want to learn more. But I think the overall thing that I learned today, and I think everyone may agree, is the fighting with COVID-19. It's a multifactorial with many aspects. But I really want to emphasize that this COVID-19 will be over. But we need to go back to taking care of our chronic problems. I told my resident again and again, we have so many chronic problems around, and controlling diabetes, lung problems, cancer, many other diseases will have a very positive impact on how we control COVID-19, COVID-20, COVID-25, or whatever number you want in the future. All right. Thank you very much. And it's my pleasure to see you all. Thank you.
Thank you very much. And please follow Dr. Win on his YouTube every Saturday, maybe Friday in the US. And I'm looking forward to learn more from you and your colleague. Thank you very much, Dr. Win.
Thank you, Dr. Wing. Have a good night.
You too. Thank you.
Yes, I would like to continue the conference with comment from Dr. Nhung from Hanoi. If it's possible, please give us some summary about what we should learn from the strategy dealing with COVID-19 in many areas in the world.
Thank you very much, everyone. I think it's very useful. Even the participant directly here is not so many, but we have a streamline so people can see back later. I think contents of our meeting today is useful for many people. We see that firstly, we can agree that the COVID-19 is a problem. But now we learn from Japan, from America, and say it's a different figure of epidemic, different approach, and different outcome. That is, we understand. So we now understand more the nature of the epidemic, and at least we know how to address, or let's say, to do with this. And of course, it's differently based on the many aspects, as Dr. Win already mentioned. So here, I think Dr. Win already left, but America have a 4 challenge. But I can compare it in Vietnam. For example, no public confidence in government in Vietnam very high. That is good. The poor coordination between the state and the federal. I think in Vietnam, I think that is good. And Japan acting is, I think, in the middle. Is the role of the government. We not classify, but we can think about this. So I think 3 things very important. The first, public confidence is most important to do with the mass activity in the population. The second is a comprehensive coordination and collaboration in emergency situation. It's very important for us as well. And number 3 is, I think it's true for every country. Accessibility for the healthcare of the people. That is important. Even healthcare system is different, but accessibility for the people is very important, especially in the emergency situation. So that is COVID-19 teach us many things. The second thing I would like to learn from one of the speaker. We see the COVID-19 is disaster, but of course we do not. All of us do not want to this happen, but it's happened. We need to face directly with the COVID-19. So now we see and to face it and fight this positively. This is I would like to be. So we need to set up the new normal safety. And in other words, we call the save existing enemies that we learn about. So we can see here some positive. Number one is a communicable disease prevention is increased capacity in Vietnam. I think in other country might be the same. TB, for example, we are from March, we already also have slogan, turn the COVID-19 disaster or the threat becomes the opportunity to end tuberculosis. That is working for TB, is working. As we see the compensation of the TB detection at the moment is very high. And the second, USC, we see the increase. Health system strengthening, we can see hospital, community health posts for the provincial and district. We see that increase medical equipment and the capacity of the health staff, intensive care, we learn. So that is useful for the later, for the health system. Coordination and collaboration is better in the health system. Dr. Momoya can see in the Vietnam, we see the system better. And the health system has better recognition by the government. That is very, very clearly. And have better recognition of the community. And you will see the improve in the high quality of care. The higher, I mean the higher, compared to the before the COVID-19. But of course, by doing that, the non-communicable disease care is increased. I mean the quality and the number of people of the care, because the capacity system higher. And number three is the better for the positive changing that are digitalized in health. In my hospital is changing very, how to say, very fast. All of this to be digitalized. And that is the meaning of the positive changing. That means something we already intend to do previously, but now COVID-19 to force people to do faster, more effectively. That is also the benefit from this lesson learned. And we know that many questions is still, why is America is still in the flood of COVID-19? Why is Japanese very big economy in the world, but the COVID-19 is still, and Vietnam, it's not very big. And economy is an income country, but we see that the GDP is still positive, it's still increase. And we invest a lot of the COVID-19. So that the balance of COVID-19 control with the cost become the question of the Quý. For example, my hospital, we invest on that. Any people working on screening, we pay additionality with the 150,000 Vietnam dong per day by law. We're happy to do that because this protect the whole hospital, protect all the patient of our with the morbidity of the lung disease. So if only one disaster happen, we can collapse on the hospital. That is, I think, the price of the many other country. Other country follow pursuits of the economy development, but COVID-19 it's come in the prevent the development. That is the lesson we apply. And many questions of the air pollution. Thank you very much, Dr. Dang. You raise many things we think we cannot explain, like PM 2.5 is an increase. When the lockdown is, we cannot explain why. And you also have a question. You measure this, you sell the cell, but it's not yet. But we see that have many information can analyze. Of course, that is the impact to the disease, impact to the policy for the prevention, and so on. So I think time is up. Thank you, Dr. Quý, for excellent chairing of this session. Thank you all the speakers, Dr. Momer, Dr. Dang, Dr. An for coordination, and Dr. Win already left. So I would say that excellent meeting. Thank you very much. Dr. Quý, say something.
Yes, thank you very much, and I'm happy to work with you on this conference and have a first chance to meet Dr. Takeuchi, who is very famous in Vietnam for the preventive care. I would like to learn more from you, and only one comment I would like to ask that may make this conference more fruitful is that I would like to express that the aggressive screening and quarantine in Vietnam may associated with misunderstanding or discrimination in the first wave, and maybe some stress and fear to the community. But actually we overcome that, and we deal with this side effect with the transparency and education, the people, the community. And I think that this problem also teach us how to deal with the NCD and how to learn with the beautiful environment in the future. And I hope that our organization can collaborate with each other to proceed the preventive medicine in Vietnam. Thank you very much.
Okay, thank you. Thank you, and keep in touch.
Okay, keep in touch.
Thank you. Yeah.
Bye-bye.
Thank you very much.
Keep good health and see you.